Welcome to episode 19. Today, I'm diving into a topic that causes struggles for so many people with hypothyroidism, and that is weight gain. We'll also cover why it can be so much harder to manage weight in the face of thyroid disorders, particularly Hashimoto's disease. Weight gain tends to be the best known symptom of hypothyroidism in the general public, so lots of people go to their physician asking to be checked for thyroid problems when they start gaining weight. Many of them don't have a thyroid problem, or at least they're told that they don't. Today, I'm going to cover how hypothyroidism affects your metabolism, why traditional weight loss methods often fall short, and what you can do to manage your weight more effectively if you have thyroid issues, or even if you don't. Whether you're someone who's been diagnosed with hypothyroidism or you know somebody who struggles with these symptoms, this episode is going to give you some valuable insights. You're listening to the Beyond the Thyroid podcast. I'm your host, Dr. Dana Gibbs. I'm an ENT surgeon and hormone specialist. For years, I struggled with my own unrecognized thyroid problems before and even after I was regularly performing thyroid surgeries. Then, one day, I learned something that turned my health around and opened my eyes to the limits of mainstream medicine in treating more subtle thyroid abnormalities. I spent the next 20 years fine-tuning my hormone expertise in disorders like Hashimoto's disease, perimenopause, and stress-related illness. Come join me as I share this new approach to hormones that empowers you to take control of your own thyroid and hormone imbalances. Let's dive in. Hello, my friend, and welcome back to the show. If you're new here, I'm so happy you found me. I'm happy to be back recording because if you follow me, you might have noticed that I've been absent from the airwaves for several weeks. Emergencies happen, and my mom's health crisis has been keeping me distracted and away from recording and from seeing new patients in my practice. But I'm hard at work getting back to the one episode a week routine I had going over the summer. So today's topic is weight gain in hypothyroidism and why it feels especially hard to overcome this very prominent aspect of thyroid disease. So before we get to it, I just want to remind you to go ahead and follow the show, or you can actually send me, if you're on the podcast version of this, you can send me a message in the show notes. So if you'll check the notes for a link, then you can ask me questions or send me messages that I can answer following the episodes. If you're on YouTube, of course, comment away. Happy to have you and hope you'll subscribe and follow. Weight gain is one of the first things many people suffer when they get hypothyroidism. So I noticed this back when I first started taking care of thyroid surgery patients in my ENT practice, like over 20 years ago. They would come back every 6 to 12 months to review their sonograms and their post-op care, and they'd complain they've gained 5, 10, 20 pounds a year. A few of them even 40 pounds in a single year or more. Almost all of them were told by their primary doctor or their endocrinologist that their labs were normal. Even those who were taking levothyroxine for their hypothyroidism were generally gaining weight. But the opposite was also true. People who were there for something else entirely, like sinus, would also complain of recent weight gain. And they had been told by their primary care doc that their thyroid was fine and that they just needed to eat less and move more. Right? And how helpful has that advice turned out to be, really? But when I would check their labs in the advanced way that's the norm in my practice, many of them did have abnormalities that suggested a treatable thyroid problem. But the problem is that just taking thyroid medicine, even the right balance of thyroid medicine by itself, frequently does not help these folks get back to where they want to be weight-wise. And what I've learned over the years is that weight gain is really a complex hormone problem, one that is controlled not just by thyroid or hypothyroidism, but by many other hormones that interact with each other. So today I want to share with you 3 things that make it particularly challenging for people with hypothyroidism to find a healthy eating plan that works for them. So what I've found is, number 1, the most important hormone when it comes to weight loss is insulin, even in hypothyroidism. Insulin is the hormone that helps our cells use glucose for energy. But many of us, 60 to 70% of us, have a genetic variation that makes our muscle cells resistant to insulin. Losing muscle mass as we age, losing our sex hormones as we age, or having thyroid problems increases that tendency towards insulin resistance, even if you don't have the genetic tendency in the first place. Stress also gives us a dramatic push towards insulin resistance because of the action of high levels of the stress hormone cortisol. This can be physical stress like illness or malnutrition or chronic pain or danger, or even mental stress like worrying about money or your kids. So what does insulin resistance mean? Well, it means your body needs to make more insulin to get the glucose that you eat into your cells to be used as energy, sometimes twice as much. So even if your blood sugar is normal, this high insulin is a trigger that turns off fat burning and promotes growth of fat cells, particularly in your abdominal area, which is where we least want it, actually. So thing number 2 is that the abdominal fat, the kind that builds up around your organs, secretes more hormones that make us crave even more glucose, even if we're already overweight. Glucose is the kind of sugar that's found in starchy carbs like bread, tortillas, potatoes, rice, and also in sweet stuff like sugar, corn syrup, honey, agave. And sadly, even the no-calorie sweeteners, even stevia, trigger us to secrete more insulin even though there's no calories in it. Even if you spit it back out, like the sweetness that's in toothpaste. Thing number 3 is that having low thyroid makes your cells even less efficient at using glucose to produce energy for movement, for thinking, or even to stay warm, which means more of the glucose you eat is then sitting in your bloodstream, hanging around, waiting to be turned into even more fat. So having high insulin much of the time, which is what happens in insulin resistance, does more than just make it impossible to lose weight. It damages your liver, promotes tumors, causes much of the damage that we attribute to high blood sugar in diabetes. And it also eventually leads to diabetes once your body cannot make enough insulin to manage the blood sugar that you take in. And both high insulin and high blood sugar lead to serious damage to your blood vessels, your kidneys, heart, liver, eyes, and brain. So this is really serious. And prediabetes is one way that insulin resistance shows itself. Weight gain is another. And wouldn't it be nice if we could figure out about insulin resistance and learn how to take care of it before you get to prediabetes and weight gain? So why do so many humans gain weight beyond what's healthy? And why does hypothyroidism make this worse? So, we humans did not evolve to handle unlimited availability of nutrition, like what we have here in the United States. We evolved to be extremely efficient at processing and storing our calories in a feast or famine environment, even to the point of being able to survive pretty brutal winters with minimal to no food availability. Our bodies, in the face of stressors, conserve and conserve and conserve. And there really are not any evolved mechanisms for thriving at a healthy weight in the face of 3 full meals per day plus snacks, to say nothing of candy, drinks made with high fructose corn syrup, and deep fat fried everything. So thyroid hormones are essential for every cell in our body. They're like the spark in your car engine. It helps you burn the fuel you take in for energy, growth, and other processes. Having low thyroid makes your cells less efficient at producing energy for movement, for thinking, or even to stay warm, which means the glucose is just hanging around, waiting to be turned into more fat. And hypothyroidism is just one more mechanism our bodies use for calorie conservation, and that can be turned on and off by our brains in response to a lot of different chemical signals. So people who have Hashimoto's disease and other untreated hypothyroid conditions just can't turn it off. So this concept is called your basal metabolic rate, and it is directly tied to the level of thyroid signaling that you have in your system. So what is basal metabolic rate? Well, that's the amount of energy per day that a person needs to keep their body functioning at some minimal level, at rest. Some of those processes are breathing, blood circulation, controlling your body temperature, making your brain function, nerve function, cell growth, and then later contraction of muscles in some minimal way. Basal metabolic rate affects the rate that a person burns calories and ultimately whether that individual maintains their weight or gains or loses. So the basal metabolic rate accounts for about 70% of the daily calorie expenditure by most individuals. 20% of your calorie expenditure comes from physical activity, and then another 10% from thermogenesis, which is defined as the energy cost of digesting our food. And different foods take more or less energy to process. So our T3 hormone levels strongly predict basal metabolic rate in scientific studies. And the amount of thyroid hormone activity plays a huge role in setting that basal metabolic rate. So if you have a decrease in food intake because you're restricting calories or dieting, that will typically lower the metabolic rate as the body tries to conserve energy. So research estimates that a very low calorie diet of fewer than 800 calories a day would reduce your metabolic rate by more than 10%. And this problem can start in as little as 25 days on a low calorie diet. So y'all probably remember that TV show, The Biggest Loser. So these were people who were really, really overweight, and they managed by extreme dieting and exercise to lose a whole bunch of weight. Well, there was a study. They followed these people for 6 years after they did their stint on the show, and almost every single one of them was still burning, on average, 600 or 700 calories less per day in their basal metabolic rate 6 years later. So their metabolism was damaged from that extreme calorie restriction. One of the ways this happens is by rapidly increasing the production of reverse T3. This lowers the thyroid hormone activity in your body and lowers the amount of active T3 you have available for burning calories. So if you don't know or you don't remember about reverse T3, after you listen here, I'd recommend you go back and take a listen to Beyond the Thyroid podcast episode 8, the 3 ways that hypothyroidism shows up. So basal metabolic rate is also proportional to your lean body mass. So in other words, the more muscle a person has, the higher their basal metabolic rate can be. Basal metabolic rate is also affected by acute illnesses and increases when you're sick with conditions like burns or fractures or infections, fever, and acute stress and type 1 diabetes. In menstruating females, the basal metabolic rate varies to some extent with the phases of your menstrual cycle. So due to the increase in progesterone in the second half of the luteal phase of the menstrual cycle, basal metabolic rate rises at the start of the luteal phase and stays at its highest until this phase ends. Menopause affects basal metabolic rate in a downward direction, unfortunately. And basal metabolic rate also varies quite a bit between individuals. So one study I found said that it could be as low as 1,027 kilocalories per day up to as high as 2,499 kilocalories in just one study, and their average was 1,500 kilocalories per day. So reduced metabolic rate means the body burns fewer calories at rest, making it easier to gain weight and harder to lose it. And strict calorie restriction worsens that problem by lowering your metabolic rate. So the lower your metabolic rate, the more calories that you eat are left over to be made into fat. So taking the right balance of thyroid hormones does help, of course, but it frequently isn't the only step that is needed. But the good news is you don't really have to drastically restrict calories to reduce or eliminate the effects of insulin resistance. And the earlier you start, the easier it is to make serious progress. This is, though, not really a diet. It's a recommended lifelong change that will make you healthier and slimmer. And there are 2 tools that I recommend to do this. First of all, you got to start by changing what you eat, not necessarily how much, but what kind of food you put in your body. So you want to eat more fat and protein and stop eating sweets and starches and quick release processed carbs. So yes, I am telling you that it's fine to eat meat. But by that, I mean fresh, unprocessed meat that you cook yourself without starchy, sugary additives, sauces, gravies, and high-carb coatings that are found in most processed and restaurant food. And preferably, you want to pick organic meat that's fed grass and has no added hormones or antibiotics to change the healthy fat content of the meat. Real meat is protein and fat. So let's talk about fat. Fat makes you full, and it doesn't require your body to make any insulin at all in order to burn it for energy. Of course, there are some fats that it's best to avoid, like processed seed oils, canola, corn, and soybean oil, or vegetable oils that increase body inflammation. Protein is a bit more complicated. It can be used for energy, but much slower and with much less insulin spike than carbs, but more than with fat. And it does take more calories to break down protein to use it for energy. Protein is also necessary, of course, for building muscle and other body tissues. It does not raise your blood sugar as high or as fast as carbs do. Next, high fiber vegetables such as broccoli, squash, and green leafy vegetables release their carbs very slowly and have a lot of fiber, which is super healthy, and a lot of vitamins, which are super healthy. Grains that are intact, such as steel-cut oats or quinoa, that take a long time to prepare, and beans and lentils are also much healthier, high-fiber, unprocessed carbs and have a good percentage of protein as well. So eating this way for several days, maybe 10 days, will, over that time, allow your body to stop craving sweets, drop your insulin level, and allow your body to start relearning how to burn fat for energy. So a great rule of thumb is to always eat a savory and relatively high fat and high protein breakfast to start, without any traditional breakfast foods such as cereal, toast, or sweetened anything. Then you won't be hungry for junk throughout the rest of your day. So anything that's made from flour of any kind, especially white flour, is a quick release carb, as is rice, potato, beets, sweet potato, low-fat milk, and anything made with any kind of sugar. These rapidly raise your blood sugar, your glucose, and your insulin level sky high. Even zero-calorie sweeteners shoot insulin up and then can drop your blood sugar sharply, which causes you to dump adrenaline and then allows your liver to start manufacturing sugar to raise your blood sugar. So anything that you put in your mouth in the non-calorie sweetener category or in the sweetener category in general will quickly stop the fat burning process as it raises your insulin. And it will also start you craving carbs and sweets all over again. This includes non-calorie breath mints, gum, and even toothpaste. All right. The second way to reduce the total amount of insulin you produce over the course of a day is to pay attention to when you eat. So basically, to reduce the amount of time in the day and the number of times per day that you consume calories that can raise your insulin. So this is sometimes referred to as intermittent fasting, and it involves eating breakfast a bit later, eating dinner quite a bit earlier, not overstuffing yourself, and eliminating any snacks. This allows your body more time between meals with very low insulin to get used to burning fat for energy. So you will find as you do these things that you actually are eating less and feeling less hungry. So just skipping breakfast is not the answer though. A recent study showed that the optimal time window for eating was breakfast or your first meal of the day around 9 and then dinner before 5 p.m. If you can do that, it's ideal, but you don't have to start there. You can start with 3 meals a day, breakfast around 9, wait 4 to 6 hours between each meal, and don't eat anything after dinner. So that's how most people start, which is not nearly as strict. And in upcoming weeks, I'm going to have more episodes with details about time-restricted eating and how it can help hypothyroid patients get control of their weight issues. So combining what you eat with when you eat and idealizing both of those things is a very powerful way to control weight and the negative effects that come with elevated insulin levels. And those elevated insulin levels are not your friend when it comes to weight loss. Now, you probably noticed I didn't say anything about exercise or specifically about cardio. I'll address this more in upcoming episodes, but in general, the thinking is that hard cardio is really counterproductive for those who are actively working on losing weight and balancing their thyroid. All right. One final note. Low thyroid function, if you have it, doesn't always show on standard thyroid testing because stress lowers TSH while it lowers your thyroid function. And high TSH is the only way most doctors diagnose hypothyroidism. So if you think you may have hypothyroidism, you want to check out my website at www.danagibbsmd.com. So there's tons of videos and resources there, as well as a link to schedule a free discovery call if you're interested in what it would be like to work with me one-on-one. All right, you guys, don't forget to like and subscribe to the episode or leave me a review if you have time. Thanks very much. Talk to you soon. Thank you for listening to this episode of Beyond the Thyroid. If you found this information valuable, it would mean so much to me if you'll take a few seconds and give the podcast a 5-star review. It helps other people who need this information find the show, and it's really easy. Just search and click on the name of the show, Beyond the Thyroid, and scroll to the bottom to ratings and reviews. I truly do read and appreciate every one. Remember, when it comes to hormones, there will always be more to discover. So follow the show so you get the next episode as soon as it's released. And if you or someone you care about needs a caring doctor to help figure out how to heal hormone problems that other doctors have dismissed, check out my website at www.danagibbsmd.com. And if you're not a physician, please keep in mind, while I'm a doctor, I'm not your doctor. The content of this podcast is my opinion, and it's for educational and entertainment purposes only. This is not meant to be individual medical advice, and you should consult your own physician for any medical issues or diagnoses that you may have. I look forward to continuing this journey with you beyond the thyroid.